वही तो यार।
Hi guys, if I'm audible and visible, please send your thumbs up in the chat box. Medicos, Kruthi, Priya, Zunaid Khan, Shimu Chaudhary, I hope the paper was good. Yes, most of the questions were repeat questions, direct and indirect. Okay. So see this question. A patient was taken into emergency room following road traffic accident. Upon investigation, he responded to pain by opening his eyes. Means eye opening was there on painful stimuli, using inappropriate words and withdrawing his hand from the stimuli. Tell me, what is the GCS? What is the GCS? Yes. So first see what is EVM, eye opening to the pain. So it is E2, V using inappropriate words. So if the person is using inappropriate words, that is V3, and M withdrawal to pain, and that is what, M4. So how much is the total score? Total score is 9. So it is E2, V3, M4. Clear? So it is E2, V3, M4. It should be M4. Okay. So C option. Anybody wants to add something in the language of question or options? Someone wants to add in the language or in the options? Yes, majority of you are correct. Okay, the same question was there. Now this is a repeat question. Clonorchis sinensis. It is related to which type of cancer? Tell me guys, what is the answer? Waiting for your reply. Sarah, Saran, Y2 Shots, Pinky, Jafar, very good. Okay, Ashok. Clonorchis sinensis. No, no, it is not bladder. Very bad. That is cystosomiasis. It is not bladder. Yes, majority of you are correct. Paras Patel, Farmer, Hardik Bajaj, Antaryami Das, Omar Mukhtar, all of you are correct. See, this Clonorchis sinensis and Opis torquis viverni, Opis torquis viverni, clear? These are risk factor for cholangiocarcinoma. So, correct answer for this question, it is cholangiocarcinoma. For urinary bladder cancer, it is Cystosoma hematobium. The name of organism, that is Cystosoma hematobium. Clear, guys? Okay. Next question, see this one. Which of the following is most common complication following major vessel ligation during abdominoperineal resection in carcinoma rectum? First, anybody wants to add something in the language of the question or in the option? Okay. Aditya Singh, gastric cancer was the option at the place of hepatic adenoma. Very good. So, it was gastric cancer. At the place of hepatic adenoma, the option was gastric cancer. Very good. It was gastric cancer. Okay. So, Ancha, Ravi Teja, Achal, Kruti Priya, you people want to say that the same question was there. Okay. During first major vessel ligation. Okay. During or following first major vessel ligation. Now, whenever we are performing abdominoperineal resection, the complications are because of injury of sympathetic system as well as parasympathetic. Clear? So, because of sympathetic system, if sympathetic system is involved, because of involvement of sympathetic system, if this is injured, so what is the problem? Patient will be having retrograde ejaculation. Retrograde ejaculation. And if there is involvement of parasympathetic system, these patients are having bladder dysfunction. There is bladder dysfunction, and these patients are having erectile dysfunction. That means impotence. Impotence and bladder dysfunction. Clear? So, if you see the combination, yes, bladder dysfunction, it is because of parasympathetic, retrograde sympathetic, so this is incorrect. Sympathetic, it is not responsible for bladder dysfunction and impotence. Parasympathetic, it is not responsible for retrograde ejaculation. So, correct answer seems to be this one, cutaneous manifestation and impotence. Clear? It is C, right? But see, the exact answer would be after, pooling of the data, when we will recall the exact language, exact option, and then only the correct answer will be told. According to this particular language and this option, here the correct answer is C. What is the common thing you have to remember? Erection is because of parasympathetic system and ejaculation is because of sympathetic system. Bladder dysfunction, it is because of injury of parasympathetic system. Clear? So, here the correct answer is C. Okay. Now, next question, what is the good prognostic factor for breast cancer? Tell me, I am waiting for your reply. Tell me guys, what's the correct answer? Sahun Khan, Kiron SK, Pradeep Jat, Satvik, Ashok Kumar. Okay, Ashok Kumarik wants to say that loss of perineal sensation. Loss of perineal sensation. In the cutaneous manifestation, there was loss of perineal sensation. There was loss of perineal sensation. Clear? Okay. Now, good prognostic factor. Yes, everybody is correct. Junaid Khan, Manoj Kumar, Prashiv, Neha Tiwari, all of you are correct. All of you. Clear? So, all of you are correct. Dr. Strange, all of you are correct. ER positive. This is a good prognostic factor. HER2 new positive, BRCA, KI67. I think one of the option was KI67. All these are poor prognostic factor. Anybody wants to change the option or wants to update the option? Anybody wants to update the option? No, HER2 new was there, I think. KI67, okay. Okay, two people wants to say that at the place of HER2 new, it was KI67, okay. Mujahid Hussain, he wants to say that sir, Byret's 5 was also there in the option. I am asking you guys, Byret's 5 was there here in the option or not? Or Byret's 5 was a separate question? Okay, BRCA1 was there, yes, correct. It was BRCA1. It was high KI67, very good. This was high KI67. It was high KI67. Okay, Byret's 5. So I think P53 was not there. It was Byret's 5. Mujahid P53 BRCA1 KI67. Okay. Okay. So I think Byret's 5 was a different question. So correct answer here, you know that ER/PR positivity, it's a good prognostic factor. So this is a good prognostic factor. So this is correct. It's the good prognostic factor. Okay. Next, Byret's 5. Byret's 5 was a different question or it was mentioned in the same question, guys? Okay, so what was the question related to Byret's 5? Can anybody tell me what were the options? Options of Byret's 5? Mahi, Vineet Kumar Pandey. Tell me, what was the question related to Byret's 5? Everybody was saying that same question. So how is it possible? Okay, in the question, what is the good prognostic factor for Byret's 5? Okay, good prognostic factor for Byret's 5 breast cancer. Okay, now it's fine. Reporting was done as Byret's 5. Very good. Reporting was done as Byret's 5. Reporting was done as Byret's 5. Okay, Vineet Kumar Pandey. Thank you, Vineet. It was, patient was having Byret's 5 patient, good prognostic factor. So what is the good prognostic factor for breast cancer in which the reporting was done as Byret's 5? Here ER positive. Okay. Next question. See this one. A 56 years old chronic smoker presented with complaints of weight loss, cough for more than 1 year. His biopsy revealed atypical cells. What is the most common cancer involved in hypercalcemia? So two clues are there here. Patient is having history of chronic smoking. So history of smoking is there. And second, there is hypercalcemia. So tell me which type of carcinoma lung it is associated with smoking and most commonly associated with hypercalcemia. Tell me guys. Mujahid, you are correct. Correct, Mujahid. Very good. Option C is large cell neuroendocrine tumor. Okay. Large cell neuroendocrine tumor. Option C. No. Oves Qureshi, Manoj Gupta. Yes. Majority of you are correct because you know that smoking, both small cell cancer, small cell carcinoma and squamous cell carcinoma are associated with smoking. But most common malignancy associated with hypercalcemia in carcinoma lung, it is squamous cell carcinoma. So correct answer is here squamous cell carcinoma. Very good. पार्थ मकवाना wants to say that sir squamous hypercalcemia लिखा था या नहीं मुझे नहीं पता. Okay, now if you have attended our marathon, you have seen that minimum 5-6 questions were directly from that marathon. If you remember, Q SOFA we discussed many times. How to remember Q SOFA? The mnemonic is QRSMS. What is Q? Q means Q SOFA, sequential organ, failure assessment. R means respiratory rate, more than equal to 22 per minute. S means systolic blood pressure, how much? Less than equal to 100 mmHg. And MS means mental status alteration. If patient mental status alteration is there, how much is the normal GCS? You know that normal GCS is 15, clear? So the GCS should be less than 15. GCS should be less than 15, clear? So what we are going to include here, respiratory rate, systolic blood pressure, and for mental status GCS. So let me see who marked the correct answer. Pinky, Sana Umar, yes, Mahi Jaglan, all of you are correct. So it is systolic blood pressure, respiratory rate, this is systolic blood pressure, respiratory rate and GCS. Correct answer is C, systolic blood pressure, respiratory rate and GCS. Clear? Okay. Now tell me what is the diagnosis here. Some students were telling me that sir, here history was given that on protrusion of tongue the swelling was moving up. Swelling moves up on protrusion of tongue. You tell me this statement was there in the question or not? Yes guys, all of you are correct. Ankit, Sabir Ali, Parth Makwana, Rahul Sahu, Helping Hand, Pinky, Satwik, Mujahid, all of you are correct. I'm just asking this question that in the question this option was there or not, that on protrusion of tongue swelling moves up, this was there or not? Okay, 3 years history of patient. Okay, 3 years old patient was there, 3 years. Okay, and on protrusion of tongue, swelling moves up, swelling moves up. So swelling moves up on protrusion of tongue. It was young male with 3 years history. Okay, young male. Okay, 30 years old man with midline swelling. Okay, it was a 30 years old man, 30 years old man with midline swelling, 30 years old man with midline swelling. Moves up on protrusion of tongue. Very good. All of you are correct. The correct answer is thyroglossal cyst. An adult male picture was there. Okay, adult male picture was there. Okay, adult male picture. Right. So it is thyroglossal cyst. Now this question is a repeat question. A 45 years old male operated for inguinal hernia. Post-operatively, he complains of pain in right thigh. Which nerve involvement leads to this complication? Male was operated for inguinal hernia. It was laparoscopic hernia repair, I think. Guys, I'm waiting for a reply. Some of the students were telling me that sir, it was laparoscopic inguinal hernia repair. It was laparoscopic inguinal hernia repair or open hernia repair? Tell me guys. Laparoscopic hernia repair. Okay. A 45 years old male operated for inguinal hernia. Laparoscopic hernia repair was done. It was laparoscopic hernia repair. Okay, laparoscopic hernia repair with mesh entrapment. Mesh entrapment was there or not? Tell me guys. There was this term mesh entrapment or not? Vineet, mesh entrapment was there or not? Okay, nerve entrapment in mesh. There was nerve entrapment. nerve entrapment in mesh. Clear? So if you are performing the laparoscopic hernia repair, what is the most commonly injured nerve? In laparoscopic hernia repair, the most commonly injured nerve, that is lateral cutaneous nerve of thigh. And if you are going for open hernia repair, it is ilioinguinal nerve. In open hernia repair, this is ilioinguinal nerve. Clear? Pain was there for 3 years. Okay. And patient was having pain for 3 years. Pain was there for 3 years. Okay. So patient was having pain for 3 years. Loss of sensation in leg region. Loss of sensation. Okay. So see, two questions are there. The most commonly injured nerve in laparoscopic inguinal hernia repair, lateral cutaneous nerve of thigh, and in open hernia repair, ilioinguinal nerve. But for this particular question, I have to check that what is the correct answer. So it will be uploaded or updated later. So there was pain, not the loss of sensation. It was pain or loss of sensation. So there was pain for 3 years or loss of sensation. Nerve stuck in fixator. Nerve stuck in fixator. Okay, it was lower limb pain. Lower limb pain. Nerve stuck in fixator, there was lower limb pain. Okay. Okay, so I update it. Right. Now see this question. A 55 years old male chronic smoker complains of weight loss. X-ray is given below. There is right apical mass. So patient is a smoker, there is weight loss also, right? So obviously it is favoring towards the diagnosis of malignancy. So which malignancy here? Right apical mass. Tell me guys, what is the correct answer? First person to reply, Ancha Raviteja. Mahesh Babu. Somebody wants to say that ptosis was also there. Very good. So there was ptosis. Why? Because you know that if there is Pancoast tumor, there is involvement of cervical sympathetic trunk and it leads to Horner syndrome. So what? Ptosis was also there. Very good. Ptosis was there. Ptosis was there. Anything else you want to add? Arm pain. Okay, there was ptosis plus arm pain. Again, it is suggestive of what? Again, since there is involvement of brachial plexus, so what happens? There is arm pain. The history was like this, that there was pain and paresthesia along the inner aspect of forearm or hand. Pain or paresthesia along the inner aspect of forearm or hand. Ptosis bhi tha. Anhidrosis was also there. Guys, anhidrosis was there. No anhidrosis. Aisha wants to say that, sir, neck pain and in interscapular region. Neck pain, aspergillosis. Neck pain in interscapular region. No. Meiosis was there. Shrudia wants to say that, sir, meiosis was also there. Meiosis. Nidhi wants to say that, sir, okay, there was a separate question of aortic dissection. Okay. Neck pain was the different question that is related to aortic dissection. Okay. Clear? So here it's a clear case of Pancoast tumor, because all of you know that what happens in Pancoast tumor, the tumor is going to involve cervical sympathetic trunk. That's why patient is having Horner syndrome, and there is involvement of brachial plexus. That's why patient can have pain in upper limb. Aortic dissection, okay. There was one question related to aortic dissection. Let me write it here only. In aortic dissection, obviously there is pain, and this pain radiates to interscapular region. Pain radiates to interscapular region. Please tell me what was the option in that question? Options, one was aortic dissection. What was the other options? Other options, tell me guys. Blood pressure difference was there, BP difference on both sides. There was widened, yes. Acute coronary syndrome, okay, since there is overlap of aortic dissection with medicine, there is acute coronary syndrome. Pulmonary artery hypertension. Yes, you are correct. Thromboembolism. There was thromboembolism. Clear? Okay guys, so there was one question related to aortic dissection. Correct answer is obviously aortic dissection because there is widening of mediastinum, pain, radiation to interscapular region. Now see this question guys, which of the following is true about the given picture? Now here, what is the diagnosis? Tell me. The same image was there or some other image was there? Tell me. Guys, the same image was there or some other image was there? Here, the same image was there or some other image was there? Okay, Foley's catheter was also there in C2. So most probably this is Fournier's gangrene. Fournier's gangrene. Clear? And in Fournier's gangrene, which is also known as idiopathic total gangrene, there is necrotizing fasciitis, means there is involvement of skin, superficial fascia and deep fascia. It is caused by mixed infection. It is caused by mixed infection, aerobes and aerobes, aerobes and anaerobes. Bladder diversion is not required. One option was orchidectomy. One option was orchidectomy. Bilateral orchidectomy is needed. Bilateral orchidectomy was needed. Bilateral orchidectomy is needed. And there was some anti-gas gangrene serum was there. Anti-gas gangrene was also there, yes. It's a repeat question of 2021. Anti-gas gangrene. Okay, correct answer is, it is mixed infection. It is Fournier's gangrene. This is idiopathic scrotal gangrene. It is characterized by mixed infection of both aerobes and anaerobes. Here, there is involvement of skin, superficial fascia, deep fascia. The structures located beneath deep fascia, those are spared, like testes, cord structure, carpora spongiosa, carpora cavernosa. All these are spared. Okay. Okay, Kurwa Suresh wants to say that, sir, anti-gas gangrene was diabetic wala question. Now see this question guys, easy question. Patient of chronic pancreatitis presented to casualty. A calculi is found in the pancreatic duct. Treatment of choice. This was the question, or straightforward the question was treatment of choice for chronic pancreatitis. Anybody wants to update the language of this question? 10 mm dilatation of duct, pancreatic duct dilatation, and how much was the dilatation? 10 mm dilatation. There was 10 millimeter dilatation. Okay, it was mentioned that in which particular part of pancreatic duct the stone was located. Ram Bhardwaj, Novo Boy. Now see, it's easy to understand. Have a look. This is the pancreas, okay, and you can see this is the duct. This is the pancreatic duct. What happens in chronic pancreatitis? There are multiple strictures. So duct is having stricture dilatation, and there is formation of stone also. So what happens? Because of obstruction, the duct is dilated sometimes, and if duct is dilated, what we can go for? We can go for pancreaticojejunostomy. And what kind of pancreaticojejunostomy? It is the longitudinal pancreaticojejunostomy, that is also known as Pusto procedure. That is also known as Pusto procedure. Clear? So it is longitudinal pancreaticojejunostomy, PJ. It was longitudinal pancreaticojejunostomy. So longitudinal pancreaticojejunostomy. Correct answer is D, that is longitudinal pancreaticojejunostomy. Very good. Suresh, very good. Now see this question. What is the treatment of choice in patients who has a mass around glans penis? Some students were telling me that, sir, it was mentioned that patient was having verrucous carcinoma and the image was given. Verrucous carcinoma image was given. Some students were telling me. Tell me guys, image was given or not? Image was given or not? Yes, image was given. Okay. There was image given. Okay. Now tell me, what were the options? One was partial penectomy. One option was partial penectomy. What were the other options? CO2 laser ablation. So it was CO2 laser ablation. Okay guys, CO2 laser ablation. It was wedge biopsy. One option was wedge. It was wedge biopsy. One option was wedge biopsy. And podophyllin. Topical 5-FU. Topical 5-fluorouracil. Podophyllin was also there. Okay, treatment of verrucous carcinoma. Topical application of 5 podophyllin was there. Okay, it was podophyllin. Now you tell me guys, this question was asked for the first time. Let me see who is going to mark the correct answer. Let me see who is a genius who is going to mark the correct answer. Tell me the answer. Let me see who marked the correct answer. Yes, Doctor 1 plus. Very good. Very good, Himani. Very good. What? Partial penectomy. What we have to go for? See, this verrucous carcinoma, it's locally malignant tumor. It is also known as Buschke-Lowenstein tumor. It is going to destroy surrounding tissue by compression, not by invasion. That's why what we have to go for? We have to go for surgical excision. We have to go for surgical excision. Clear? So we go for surgical excision. It's actually local excision. So which one is preferred answer here? We go for partial penectomy. Correct answer is D. It's partial penectomy. Okay, age was 50 plus, 55 years old. Very good. It was 55 years old male without no enlarged lymph node. Very good. 55 years old male. Years old male. No enlarged lymph node. There was no enlarged lymph node. There was no enlarged lymph node. Okay. Shudia wants to say that, sir, you have taught this in your lecture. I have read a day before. Thank you and congratulations that you marked this question correctly. First line treatment for liver abscess. This question was there guys or not? First line treatment of liver abscess. This question was there? First line treatment of liver abscess. Yes or no? Tell me guys. Yes? Okay. What was the option? First line treatment of liver abscess. What was the option? 75 cc. Okay. 75 cc. Liver abscess. First line treatment 75 cc. Medical management pair. Medical management pair. FNAC drainage. surgery needed. Yes, surgery is required in this case, so surgery is needed. Percutaneous drainage, okay, it's the percutaneous drainage. So what is the correct answer here? Yes, percutaneous drainage. Whenever patient is having liver abscess, we have to go for ultrasound or CT guided percutaneous drainage. So it's the percutaneous drainage. Clear? Correct answer is percutaneous drainage. That's correct. Okay. Next question. Classify CEAP category of varicose vein with eczema. Tell me guys, CEAP categories. Yes, you know that C0, no symptom or there is no sign. What is C1? There is presence of reticular vein. Reticular vein. If the patient is having C2, C2 means varicose vein. In C3, the patient is having edema. In C4A, this patient is having eczema. C4A eczema, and in C4B, there is lipodermatosclerosis. C5, there is healed ulcer or healed wound, healed ulcer or healed wound, and C6, there is open wound. There is open wound. Clear? So what is the correct answer guys? C4A. Let me tell you, the same question was asked 2 years back in NEET PG, but they just asked that if there is presence of varicose vein, what should be the C? It is C2, varicose vein. So here, since there is eczema, correct answer is C4A. C4A. Majority of you are correct. Very good guys. Nikhil, I want answer key of whole NEET PG 2023 PDF. Yes, we will upload very soon. Don't worry. Let me just recall it, recollect everything, and we are going to upload it. Sir, it was amoebic liver abscess, 1 week history of diarrhea. Amar Khan, remember guys, if it was amoebic liver abscess, then we will go for medical management. Amoebic liver abscess with 1 week history of diarrhea, in that case we go for medical management. Okay, questions are different. ठीक है, ठीक है. Now see this question. A 43 years old male alcoholic patient came with complaints of loose motion 1 week ago, now presents with pain in hypochondrium. What is the next step in management? See, the patient is having loose motions. Clear? It means this patient was having short history, this patient was having diarrhea. Clear? Now patient is having pain in hypochondrium. It means now patient is having what? Liver abscess. So in which case there is diarrhea also, there is liver abscess also. Yes, this is because of amoeba. This is amoebic liver abscess. And in this amoebic liver abscess, what we have to go for? Yes, we have to go for medical management. We go for oral, high dose oral metronidazole. Metronidazole. So we give high dose oral metronidazole. So this was the question, and here the quantity of pus was 75 mm or 75 cc. Okay, guys, tell me, this 75 cc was mentioned on ultrasound. This was the question, that ultrasound was done, and on ultrasound there was 75 cc of pus. Hydatid cyst question was there. Yes, I know, it was a different question. Dose of metronidazole, it is 750 mg TDS for 10 to 14 days. This is 750 mg TDS for 10 to 14 days. Okay. So if this question is there, in that case, if amoebic liver abscess is there, history of diarrhea and pain is there, in that case we have to go for what? We have to go for medical management. And if there is pyogenic liver abscess, we have to go for ultrasound or CT guided percutaneous catheter drainage. Clear guys? Okay, another question. There was one question related to Graves' disease. Image was there. Asked about antibodies. Can you tell me what is the name of antibody in Graves' disease? Long-acting thyroid stimulator against TSH receptor. So long-acting thyroid stimulator against TSH receptor. Can anybody tell me Okay, anti-thyroglobulin, anti-thyroglobulin, anti-TPO, anti-TPO. What was the other options? Against TSH receptor, against TSH receptor. Very good. Can anybody exactly tell me? Okay, medical student 23 years old, medical student 23 years old, 23 years old with exophthalmos, exophthalmos. Tell me guys, the image of exophthalmos was given or not in the question? Serum thyrotropin, anti-TTG, okay. Exophthalmos image was there, image was there. Exophthalmos image was given. Okay, so correct answer is obviously it is against TSH receptor. You know, Graves' disease, here there is stimulatory auto antibodies against TSH receptor known as long acting thyroid stimulator. Okay, palpitations and heat intolerance. Very good. There was palpitations and heat intolerance. Patient was having palpitations and heat intolerance. There was heat intolerance. There was heat intolerance. There was sweating, tachycardia, palpitation and sweating. Tachycardia, palpitation and excessive sweating was there. Okay, how to diagnose? The question was how to diagnose? How to diagnose? Very good. So correct answer is here, antibody against TSH receptor. Very good guys, very good. All of you were correct, very nice. Now there was one question something like this, raised ALP, the patient was having jaundice, ductal dilatation and collection in the duct. Something like this. There was one question, tell me guys, you remember? ALP, raised jaundice, ductal dilatation, collection in duct. Anybody remembers? Language, exact language of this question? Yes, there was a child extrahepatic biliary plug was there. There was biliary plug. Biliary plug. Pale stool. There was pale stool. Crigler-Najjar syndrome. Correct answer is extrahepatic biliary atresia, EHBA. It is extrahepatic biliary atresia. AST, ALT was normal. AST, ALT, it was normal. Yes, Dubin-Johnson syndrome. Liver biopsy shows duct proliferation. On liver biopsy, there was duct proliferation. Duct proliferation was there on the liver biopsy. Alpha fetoprotein was increased. Fibrosis of bile duct. Okay. So all these are suggestive of what? Extrahepatic biliary atresia. Alkaline phosphatase was 204. Somebody remembers the value. ALP was 204. And hepatocellular carcinoma. Hepatocellular carcinoma, it's not very common in children. Okay. Okay, so correct answer is extrahepatic biliary atresia. There was another question. Superficial ring, its opening in, obviously external oblique, and deep ring, its opening in fascia transversalis. Jaundice was there. Bilirubin was 2.6. Yes. So superficial ring, it's the opening in external oblique muscle. The same question was there or some other question was there? Tell me guys. Same question was there or some other question was there? Question was deep ring. Okay. It was deep ring. So deep ring, it is the defect in fascia transversalis. deep ring, it is in the fascia transversalis. HCC was a separate question. Okay. Okay. HCC was a separate question. So anybody can tell me what was the question related to hepatocellular carcinoma? What was that question related to hepatocellular carcinoma? Okay, alcoholic patient was there. Alcoholic patient, raised alpha fetoprotein, ALT AST was normal. ALT AST was normal. Cholangio, option was cholangio, hepatocellular carcinoma, cholangiocarcinoma. Anybody remembers other option? Cholangiocarcinoma, HCC. What were the other options? Anybody remembers? Hepatic adenoma. ALP was also raised. There was raised ALP, hepatic adenoma. And what was the fourth option? Hepatic adenoma. And fourth option, guys, RCC. RCC was there? No. Alcoholic hepatitis. It was alcoholic hepatitis. Okay, another question. Age of the patient was mentioned in the question. Age. Okay, there was alpha fetoprotein. There was weight loss also. Anybody remembers age was mentioned? Age of patient was mentioned. Old patient, 55 years old, 55 years. Weight loss. No, it is not cholangiocarcinoma. No. See, alpha fetoprotein is raised. In cholangiocarcinoma, alpha fetoprotein is not raised commonly. Alcohol is the risk factor for what? Hepatocellular carcinoma, guys, is the clear-cut case of hepatocellular carcinoma. So many clues. Old patient, weight loss, alcohol, raised ALP, raised alpha fetoprotein, ALT, AST is normal. Clear? This is not hepatic adenoma. Ancha Ravi Teja, ALP is not specific for cholangiocarcinoma. Can anybody tell me what is the marker for cholangiocarcinoma? Specific tumor marker for cholangiocarcinoma. Is it ALP? ALP is because of any kind of obstruction in the bile duct. It's stone, it's any malignancy, any kind of stricture. If CBD will be obstructed, ALP will be raised. CA 99, very good. Novo Boy, Vedant Purohit, all of you are correct. Very good. So here the correct answer is HCC. There was repeat question. This question was asked in NEET PG 2021. Exact repeat. The same question was there. To a 30 years old female presented to the hospital with abdominal pain, weight loss and sterile pyuria. Radiograph is given below. What is the diagnosis? This is putty kidney. Putty kidney, okay? So this is putty kidney. Exact image, yes. Putty kidney. There was another question on raised conjugated bilirubin. Okay, tell me guys, you remember that question on raised conjugated bilirubin? Rectal polyp contain mucin and glandular proliferation between hamartomatous or adenomatous. If it contains mucin and there is glandular proliferation in rectum, chances are that this patient is having hamartomatous polyp. Harini Gajendran, can you tell me more about this question? Rectal polyp question. Okay. 5 years old child. It's a classical 5 years old child. Bleeding PR. Bleeding PR. Okay. These patients are having juvenile polyp. Juvenile polyp. Clear? And you know the juvenile polyp is what? This is typically hamartomatous polyp. It is hamartomatous polyp. Let me tell you guys again, it's a repeat question. It's a repeat question of NEET PG. Image of biopsy was given. Biopsy image was given. Choriostoma. One option was choriostoma. One was adenomatous polyp, Peutz-Jeghers syndrome, adenomatous polyp. Okay, because previously when this question was asked in NEET PG, they provided the histopathological image. The description which you are telling here in the question, that was given in the form of histopathology. Okay, so here correct answer is hamartomatous polyp. Let me tell you, rectal polyp in children, it is juvenile polyp seen in 5 years of age. Most common presentation is bleeding PR. There is mucus discharge also. And what is the treatment? We perform polypectomy. We perform polypectomy. Okay, there was one question on aspirin. Aspirin, there is history of hematemesis and melena. Anybody remembers that question? Question related to aspirin. There was keloid image also. One question. What was this question? Keloid, history of previous surgery. Anybody remembers? Mucin, large number of glands. Large number of glands. Colonic proliferation in rectum. Colonic proliferation in rectum. What was the question related to? Options. Shrishti Sengar, can you tell me what was the option related to the question keloid? There was image. What was the option? Tell me the options. Options, guys, options. Option was thrombophlebitis. One option was thrombophlebitis. One option was hypertrophic scar. History of trauma 5 years back. There was history of trauma 5 years back. 5 years back. Another option was keloid. And what was the fourth option? Hypertrophic scar was not there. Okay, hypertrophic scar, it was not there in the option. Thrombophlebitis, keloid. Hemangioma. One option was hemangioma. Only 3 months history. Somebody is saying 5 years. Somebody is saying only 3 months history. Neurofibromatosis. Okay. Another option was neurofibromatosis. So, you know, after history of trauma or surgery, if there is excessive scar tissue which is growing beyond the original boundary of wound or incision, if it grows beyond, it is keloid, and if there is excessive scar tissue within this original wound or incision, that is known as hypertrophic scar. 5 years only. So, there was 5 years history. Okay. Trauma to chest, 5 years back. Right. Any other question you remember, guys? The patient who consumed sodium hydroxide, what? See, patient who consumed sodium hydroxide, so alkalis are more dangerous or acids are more dangerous? Tell me, which is most dangerous, acid or alkali? Tell me, guys. There is sodium hydroxide ingestion. Next best step. Alkali. Why alkali is most dangerous? Because it is going to cause liquefactive necrosis. So, if any kind of endoscopic attempt should be done or any kind of intervention you will try to do, it will cause perforation. That's why safely in these patients we go for what? We go for feeding jejunostomy. Very good. So what were the options, guys? Tell me. One option was feeding jejunostomy. Yes. Feeding jejunostomy. Gastrectomy. Second option was gastrectomy. Gastrectomy. Esophagojejunostomy. We are not going for anastomosis. Esophagojejunostomy. There was esophagojejunostomy or gastrojejunostomy. Stenting. Stenting was there, and gastrojejunostomy. Gastrojejunostomy. Okay, somebody wants to say that, sir, one ulcer image was given. One ulcer image was given, and the options were arterial ulcer, malignant ulcer, venous ulcer, trophic ulcer. Can anybody tell me what kind of image was there and what was the answer? It was arterial ulcer, venous ulcer, trophic ulcer, malignant ulcer. Ulcer image. Ulcer on foot. So if ulcer on foot is there, chances are it is not venous ulcer. Lateral aspect of foot, where exactly? It was trophic ulcer, most probably. Callosities was present, diabetic patient. Okay, see, if the patient is diabetic, if there is callosity, so the chances are it is trophic ulcer, because it is because of loss of sensation. Trophic ulcer. Arterial ulcer, whenever there is occlusion of artery. Clear? Venous ulcer, when patient is having varicose vein. So options were trophic ulcer, venous ulcer, arterial ulcer, malignant ulcer. Arterial ulcer, malignant ulcer. Malignant ulcer. Okay? Okay. SDM Bevda, nice name. He wants to ask that, sir, there was one gangrenous abdomen image with dyspnea. Choose the correct option. Hyperbaric oxygen. Can anybody tell me about that question? Gangrenous abdominal wall. Most probably it was a case of Melanese gangrene. This was gangrenous abdominal wall with dyspnea. With dyspnea. What was the option, guys? Can anybody tell me? Gangrenous abdominal wall with dyspnea. Option, it was Melanese, yes. Absolute dysphagia. There was absolute dysphagia. Incorrect option पूछा था, okay? Incorrect. Now can you tell me the options, guys? Incorrect about Melanese gangrene. Incorrect about Melanese gangrene. Incorrect about Melanese gangrene. Okay? Yes, no. Hyperbaric oxygen improves. Hyperbaric oxygen improves the healing. It improves the healing. So hyperbaric oxygen not useful in the management. This is incorrect. Radical excision daily. No, we are not going for radical excision daily. But we are going to excise the necrosed or gangrenous part. Resection done 24 hours. Extensive surgical debridement. We can go for extensive surgical debridement should be done. Extensive surgical debridement. Perform extensive surgical debridement. Every 24 hourly. Every 24 hours. Anybody remembers other options? Apart from surgical debridement, hyperbaric oxygen, anybody remembers the other options? Typical case of Melanese gangrene. Yes, it's a typical case of Melanese gangrene. Typical case of Melanese gangrene. And in this question only, that anti-gas gangrene serum was there? Yes, there was one question related to tracheostomy image. One is Melanie itself. Okay, streptococcus and sometimes polymicrobial cause. Streptococcus and sometimes polymicrobial cause. Very good, guys. Somebody is telling me that, sir, there was one question related to hepatoblastoma. Anybody remembers that question related to hepatoblastoma? Hepatoblastoma question. And somebody wants to tell me that, sir, there was one question related to necrotizing fasciitis. That was Fournier's gangrene. Anybody remembers that question related to hepatoblastoma? Okay, there was anastomosis between superior rectal vein and sigmoid vein. What is that question? Esophageal vein and left gastric vein. What is that question? Okay, guys, if somebody is having question of surgery, yes, you just post the question in the chat box. Okay, there was cirrhosis will lead to, okay, very good question. Saida Nazia, thank you, Saida. Cirrhosis will lead, in cirrhosis, the bleeding occurs from, so cirrhosis leads to portal hypertension. And where is the bleeding? You can see here, it's a very easy question. There is portosystemic anastomosis. You can see here, this vein is azygous vein and this vein is left gastric vein. So there is portosystemic anastomosis between azygous vein is esophageal vein and left gastric vein. Azygous vein and left gastric vein. So in patient with severe cirrhosis, what veins to be anastomosed? No, we are not going to perform the anastomosis. Okay. Portovenous anastomotic site was asked. Portovenous anastomotic site. Portovenous anastomotic site. Clear? So obviously that is between esophageal vein, that is azygous vein, and gastric vein, that is left gastric vein. So it's gastric and esophageal. Okay. This is one question. Anybody remembers another question? In Fournier's gangrene, urinary diversion is not mandatory. We are not doing it routinely. We are just performing extensive debridement. Crescent Cypress wants to say patient willing to do anastomosis. Patient is willing to do anastomosis of what? One swelling over right face image. Phrenic vein was also given. Swelling over parotid region. Guys, tell me, what was that question? Swelling over parotid. Anybody remembers? Swelling over parotid region. There is swelling over parotid region. Okay, EDH-CT brain image was there. EDH-CT brain image. Anybody remembers the exact question and option? Guys, tell me what was that question related to swelling over parotid? EDH, SDH, SAH. Okay, EDH, SDH, subarachnoid hemorrhage, intracranial hemorrhage. Okay, swelling in parotid region, which nerve is affected? Swelling in parotid region, which nerve is affected? Tell me, what were the other options? Which nerve is affected? What were the options? Obviously, tell me which nerve which is having 5 branches here in the parotid region. History of fall 1 week back in EDH. There was history of fall 1 week back. Okay, The question was swelling in parotid and there was pain because of involvement of which nerve? Facial nerve, auriculotemporal nerve, facial nerve, auriculotemporal nerve. Okay, swelling over parotid region, it is mixed consistency. Swelling is of mixed consistency. Behind ear, yes, swelling is in front of ear, below ear, lobule and behind. Behind. It is mobile, variable consistency. All these findings are suggestive of what? Pleomorphic adenoma. There was X-ray image of neck. What was that X-ray image of neck? Anybody remembers? X-ray image of neck was there. What was that question? अंधेरा कायम रहे. Very good. अंधेरा कायम रहे. करिश्मा, राजगोपाल. Necrotizing fasciitis, Fournier's gangrene, two different questions. Yes. Now guys, any question was there related to kidney stone, bladder stone, injury to bladder, injury to urethra, urethral injury, bladder injury, any question related to rectum apart from this APR, any question related to intestinal obstruction, intussusception, volvulus, volvulus, burns plastic surgery, flap, some instrument, any question related to trauma, sutures, shock, bariatric surgery, renal calculi was there. Gautam Raja Gopal wants to say that sir, renal calculi, kidney stone was there. Okay. Any question related to GIST, carcinoid tumor, pheochromocytoma, neuroblastoma, carcinoid tumor, GIST, pheochromocytoma, neuroblastoma, hypertrophic pyloric stenosis, tracheostomy tube image was there. Okay. Sudden hematemesis, carcinoma cervix, nephrocalcinosis, no renal calculi. Okay guys, so I hope these were the questions of surgery. There might be 2-3 more which we are going to add. If somebody remembers other options or other questions, please send the questions in the chat box. Okay, yes, there was one question related to Mallory-Weiss syndrome. Right guys, so thank you very much for your cooperation and for your feedback. I'm able now, just because of this particular chat, I'm going to recall almost most of the questions with exact language, because all of you have provided your input into this recall session. Thank you very, very much, and I hope that all of you are going to crack this exam with flying colors. Okay, take some rest, relax, and if you remember anything in this particular video, in message box or chat box, you can send. In comment section, you can send all of those questions, images, if you remember any or if you are going to get any. Okay, thank you guys, thank you very much for your help. Thank you and best of luck for the results.